Good afternoon, everyone. Welcome to Oscar Care Group's webinar on finger food and dementia. My name is Kiarra, and I'm an accredited practicing dietitian. It is Dementia Action Week, so we're here to encourage everyone to learn more about helping those with dementia. Dementia is a brain condition that can affect one's mood, memory, thinking, and behaviour. It's not a normal part of aging, and unfortunately, there is currently no cure. In Australia, more than 421,000 people live with dementia. It is the leading cause of death for women and the second leading cause of death overall. There are so many different types of dementia, including Alzheimer's disease and vascular dementia. Symptoms will become stronger over time, and progression could be quick or could take years. There are 3 stages of dementia. Early stage dementia is where most people are able to support themselves. Middle stage dementia is where the changes to one's mood, memory, thinking, and behaviour are stronger. These stronger changes mean more support may be needed from other people, including in the home and the community. Late stage dementia is where symptoms are very strong. One may be unable to communicate, walk, talk, look after oneself, remember people or places, or how to eat with cutlery. Much more support is needed. So changes may occur in the way that food is experienced. There may be a loss of appetite, forgetting to eat or drink. It may become harder to recognize when one is hungry or thirsty. We may lose the ability to tell if food is too hot or too cold, those hunger cues. We may have trouble using cutlery. We may always feel hungry or crave salty or sugary foods. There may be forgetting how to chew or swallow, or even taking bites that are too big for us and may indeed increase the risk of choking. There may also be some difficulty eating or feeding oneself. And with all of this, we do often see weight loss and malnutrition. Mealtimes can become difficult for someone living with dementia. It might be tricky to identify items on a dining room table, for example. So what are some ways that we can support someone with dementia around eating? We can certainly plan for meals to be social occasions wherever possible. Consider the way the person has liked to eat, such as a small appetite, a big appetite, a sweet tooth. Track the eating habits. Watch for behaviours such as hiding food or not eating regularly. Encourage drinking regularly to avoid dehydration, and certainly let the doctor and the dietitian know if you notice any new symptoms. To make mealtimes easier, serve familiar food, serve one course at a time in smaller portions, serve food at safe temperatures for eating. You can remove distracting items from a table, such as extra cutlery or extra glasses, salt and pepper shakers. Be sure to minimize noise, activities, and other distractions. You can use contrasting colors and colors that are different from the placemat or the table, and minimizing the complex patterns as well. Just make sure that the room is well lit, and a great option are some finger foods. All right, so what are finger foods? Finger foods are reasonably low mess. They're easy to eat without the need for utensils. Think about foods that you could comfortably eat whilst walking. They're nourishing nibbles that provide great opportunities for both increased dignity and food intake. They promote independence and quality of life. They increase food acceptance and minimizing that overwhelming feeling that is often caused by large servings. They optimize oral intake and they allow for protein to be spread in small bite-sized quantities through the day, as opposed to that large hot meal. So some finger food ideas, there are so many, but just to mention some, we have sandwiches cut into fingers, donuts, vegetable sticks, vegetables cooked into patties or fritters, potato wedges, hash browns. You can cut fruit into pieces, certainly biscuits, rice cakes with avocado or Vegemite. And then you have the pastry, so sweet, savory, croissants, danishes, pizza rolls, muffins. There are just so many ideas. Finger foods can be a great way to increase the energy and protein in one's diet. Some examples could be an ice cream sandwich, quiche or frittatas, yogurt pouches, bagel with cream cheese, ice cream cones, sushi cut into small pieces, cheese sticks, fish fingers, nut bars, rice cakes with a protein spread such as peanut butter. You could have crepes rolled up with a high protein filling as well, such as peanut butter. You can have a cheese toasty cut into fingers, squares, or triangles. There are so many ideas. Finding finger food suitable for texture modified diets can be more challenging. It does vary depending on the IDSI level. So some ideas for the regular easy to chew diet could be peeled banana, mini cheesecakes but no base, soft cheese slices. For the soft and bite-sized diet, an idea could be soft tofu cut into small pieces. For the minced and moist diet, we could look at a rice pudding pouch. And for the puree diet, we could certainly look at a yogurt or a custard pouch. So we're going to jump on to quite a few tips on creating the best finger foods. I'd like to make a note that these tips are focusing on a regular diet and they may not be suitable for a texture modified diet. All right, so we really want to make the most of every mouthful. Residents who are most likely to benefit from finger foods are also likely to be at an increased risk of malnutrition. So food fortification should really be implemented into finger foods. We really want to aim for high energy, high protein options to add that extra energy and that extra protein into every mouthful. Into every bite that we take, you want to have extra energy and extra protein, and it doesn't necessarily mean more volume. So ways that we can do this could be adding cheese, cream, and or full cream milk powder to quiche or a frittata recipe. We could add spreads such as peanut butter, cream cheese, pâtés, and beans to toast or sandwich fingers. We can also use nourishing dips such as satay sauce, cottage cheese. You can do sweet chili with Greek yogurt. And these are much better options than the low protein sauces such as tomato sauce or mustard. We can make mini versions of food. Making small versions of food instead of cutting up traditional foods is a great idea. This could be mini frittatas, mini quiches, mini sausage rolls, pinwheels, sliders or burgers, mini meatballs, mini sausages, mini pikelets, mini vol au vents with high protein toppings or high protein fillings. You can do mini cheesecakes, tarts, cupcakes, and even mini muffins. There are so many ideas. All right, tip number 3, get creative. Try turning traditional main meal foods into finger foods. So for example, this could be turning scrambled eggs onto toast into boiled eggs that you cut in halves or quarters and you serve those with buttered, cheesy toast soldiers. And another option could be turning your regular risotto into mini cheesy arancini balls. All right, so another idea or tip is to prepare food so it does not fall apart. Ideally, finger food should not fall apart when eating with the hands, so we really need to try prepare foods to be moist and sticky. You can turn rice into rice balls by overcooking the rice and mixing it with melted cheese. You can turn rice into rice cakes by mixing the cooked rice with eggs and cheese, and you can pan fry that as rice patties. All right, tip number 5 is to use mugs. So thinking of dishes that are traditionally served in a bowl, such as soups, and these may be better tolerated in a mug. All right, tip number 6, top with sauce and dips. So preloading foods with dips or toppings to nourish oral intake. So an example could be arancini, for example, topping that with the sauce so that it's ready to pick up and pop straight in the mouth would be ideal. All right, tip number 7, would be really great to make finger foods available all day. So considering making finger foods safely available throughout the day is a great opportunity to increase oral intake for residents who may become easily distracted. All right, so adapting foods already on the menu is tip number 8. So yes, you can certainly create a new finger food menu. However, a better approach is to focus on adapting foods already on the menu that are being served to all the other residents. All right, tip number 9. This is on sandwiches. Now, sandwiches are a common socially acceptable finger food and that many people would have consumed regularly throughout their lives. It provides the benefit of optimizing mealtime dignity. And for residents that do walk laps of corridors, for example, finger foods may actually allow them to mobilize whilst eating without that sandwich falling apart. So some great example filling ideas could be hummus, baba ganoush, peanut butter, honey and cottage cheese, cream cheese with pesto. You could do pâtés, you could do refried or mashed beans. You can do tuna and mayonnaise or egg mayonnaise and avocado, and even smoked salmon with cream cheese is great. All right, tip number 10 is getting the temperature right. So we want to make sure that we're serving foods that are not overly hot, but also not cold. So they've got to be just right. All right, tip number 11 is minimizing crumbly foods. So we really want to avoid crumbly, slippery, and messy foods. Tip number 12, this is really important and we want to aim to avoid sharp objects. So you can get some really pretty toothpicks, but be mindful of who will be eating these. So ideally aiming to avoid sharp objects such as toothpicks, skewers, and straws. All right, tip number 13 is supervision. So ensuring that adequate supervision and proper precautions are taken to prevent or minimize risk of choking or accidents. And this could even be someone slipping on a spilt food or beverage. So we really want to adhere to that tip before about minimizing the messy foods too. All right, this is such an important tip, number 14, promoting dignity. So hopefully the finger foods can help promote dignity, and we just need to remember to ensure good hygiene practices at the same time, so including washing and or sanitizing hands before and after eating, and keeping serviettes and wet wipes within reach to assist with cleanup and promoting that dignity. All right, tip number 15, refer to a dietitian. So for personalized support and ideas tailored to individual needs and preferences, please reach out to one of our accredited practicing dietitians. We also offer more detailed training on finger foods. We go into a lot more ideas. We also offer training on dementia, malnutrition, the high energy, high protein diet, and a food first approach. We can also assist with developing finger food menus or recipes for you. All right, and in summary, finger foods can be extremely valuable. They can help increase feeding independence, promote dignity. They can increase oral intake and improve nutritional status. Remember, we really need to consider that chewing and swallowing abilities need to be considered when choosing foods, and that nutritional requirements do need to be met. So you can reach out to a dietitian for help. At Oscar Care Group, our amazing team of dietitians can combine the nutritional requirements with practical strategies, and the aim would be to increase dignity and quality of life while meeting the requirements. All right. So at Oscar Care Group, we have 20 aged care dietitians around Australia to help. And dietitians are a reliable source of evidence-based nutrition, so please always reach out to a dietitian for support. So how can we help? Certainly with one-on-one personalized consults with residents, that personalized support through getting to know a resident, the data collection, and speaking to chefs as well on what can be done within each home. Along that line, menu development and reviews, the menu and mealtime quality assessment as well, education sessions, malnutrition screening, and supplement reviews as well. Now, we also have a clinic in Mount Waverley, Victoria, which you can reach out for face-to-face dietetic visits or via telehealth as well. All right, and tomorrow we're very excited to have our wonderful speech pathologist, Michaela. She will be presenting on dementia and speech pathology more than dysphagia. Be sure to register on our website so you don't miss that one. And thank you so much for joining this webinar. I hope that you have a lovely rest of your day. Thank you.